everyone. My name is Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves.
Welcome everybody to Airing Addiction. So glad that you're here joining us, whether you're listening to this live or on your favorite podcasting app. Happy Recovery Month. September is Recovery Month. So excited to be with you. We actually are having a weekly Airing Addiction this month. Normally we podcast about once a month, and for Recovery Month, because it is such a special month and we want to just pack so many great guests into this podcast, we are going to be podcasting once a week. So be on the lookout for that, for fresh episodes every week in Recovery Month of Airing Addiction. So I'm very excited about our guest today. I'm going to turn it over to Lisa to introduce our guest to kick us off for Recovery Month.
Thanks so much, Jesse. This guest is a long time coming. So she is someone who I've known for a very long time, have worked with closely for a very long time, and we've talked about having her on the podcast for a very long time. So I'm really excited to start off Recovery Month with this guest. So we have Dr. Jessica Griffin with us today. She's a clinical and forensic psychologist, associate professor of psychiatry and pediatrics at the University of Massachusetts Chan Medical School. And we're here to talk about parental substance use, supporting the parent-child and caregiver-child relationship in the context of addiction and recovery. And I can't think of a better person to talk to about that than Jessica. So welcome. Thanks so much for joining us.
Thank you for having me. I'm excited we finally were able to make it happen, and I'm honored to be here to kick off Recovery Month on such an important topic. You guys have been doing amazing work, and all the different podcasts you've done over time here. I've really enjoyed listening to all the different speakers you've had on. So congrats on the podcast right out of the gate.
Thanks so much. So, sometimes depending on who we have on, we start with kind of, somebody's own personal story. And I think that this time we want to start with, how did you end up kind of having a bit of a focus on supporting children? I know you have a background in child trauma, and how does that interface with addiction? What have you learned through that lens of child trauma?
Great question. So I'll take you on a little bit of a history here. I first started my initial work, like in graduate work, I was really interested in family systems work and attachment. I was looking at it more from the adult lens, and people who struggle with mental health problems over into adulthood. But so many times it was coming back to disruption in attachment or the caregiver-child relationship, and many times related to childhood trauma. And so over time, my career became more focused on attachment and children and really just relational health in general. We started the Child Trauma Training Center at the university back in 2012, and it's now called Lifeline For Kids. But as part of our program, which focuses on trauma statewide in Massachusetts, as part of our program, we have an access line called Link Kid, which is where anybody could make a referral to evidence-based treatment for trauma. And so we've referred between 6,000-7,000 children to trauma-focused treatment, evidence-based trauma-focused treatment in the Commonwealth. And when we look at that data, and we look at the types of trauma that kids are exposed to, trauma or adversity, around 40% of the kids who come through our referral lines, so these are kids exposed to trauma, around 40% have parental substance misuse as part of that picture. When we look at the children who have parental substance misuse versus those who do not, kids with parental substance misuse have an average of 2 more types of trauma on top of their trauma exposure. And so you all know this, that substance misuse can sometimes serve as a gateway to other kinds of traumatic experiences happening to children that impact on attachment, child neglect, other kinds of traumatic experiences happening. And so for us, that data is very concerning. Then also we do a lot of training of clinicians in trauma-focused treatments, particularly trauma-focused cognitive behavioral therapy. So we've trained thousands of clinicians, not just Massachusetts, but all over the United States, in this particular treatment approach. But what we hear time and time again from clinicians are they're not sure how to address parental substance misuse. How do I explain what an overdose is to a 7-year-old? How do I talk about addiction with a 12-year-old? And so we decided several years ago, in collaboration with Lisa, to develop some tools, some training for clinicians, and pull together resources to help us all be able to do this work. So I know I said a lot, and I'll stop there and turn it back to you guys. But that's kind of the history behind why we're sort of focusing on this now.
Thanks, Jessica. And it certainly hits near and dear to home for me, both personally and professionally. Like we were talking before we kicked off our podcast here, I'm somebody who's in recovery from substance abuse disorder, as well as a parent. I've also had the experience of doing family work for Spectrum Health Systems for a number of years, and being faced with that challenge of what is appropriate to share, what isn't appropriate. And there's some great resources out there, statewide, nationwide. And I'm wondering if you could just touch on that maybe for someone that's listening and, wondering, how do I explain this to a child? Or, what a big question I would get often, I would love to hear your input on this, is at what age should I start explaining addiction to my child?
Such a great set of questions, Jesse. And, I think I don't think there's one person, myself included, who hasn't been touched by addiction, whether it's through personal experience, family members, a child who's grown up, with parents who struggle with addiction. And so one of the things that's always troubled me is, well, why aren't we talking about it more? But part of the dynamic around addiction in families is the secret keeping. And so taking this trauma-informed approach, one of the ways that we can start to break that down is by talking about it, having the language to make that unspeakable more speakable in families, including with kids. And by the way, this applies to young children too. Kids pick up very early on that things may not be, they're tuned into parents. They know if a parent is there and consistent or not tuned in. And children, as young as preschool age children, they could benefit from some psychoeducation, some information about what's happening with the parent. Sesame Street Workshop has developed some really wonderful tools for children as young as 3 or 4 that have character who's had a family member struggle with addiction and substance misuse. And there are, coloring books, sheets that they can do together, videos parents or grandparents, who's ever in that caregiver role, can watch with the child and talk about the child. Because what we find is that when children aren't given developmentally appropriate information, they're going to fill in the blanks. And they're going to fill in the blanks with thoughts about it that aren't accurate, many times blaming themselves. Well, if I just would have done better on my math test, maybe mom wouldn't have drank that night. Or maybe if, Johnny and I weren't fighting, I wouldn't have stressed dad out so much, and then he wouldn't have decided to get high. So what oftentimes happens is kids will internalize that. So part of what we're trying to do in getting resources out to families is providing that psychoeducation so that kids don't feel alone, that families have the tools to talk about it. For parents who are in recovery who want to know, well, I don't know what to say to my kids, so I'm going to say nothing. We want to give them the tools to be able to talk about it, to let kids know it's okay to talk about it. And that's really the first step to having that really trauma-sensitive approach for children in a way that I think is not just respectful of the child's needs, but that parent too, that who wants to be a parent and wants to know, well, how do I do this repair work?
And talking about it is one of the ways to combat the shame and the guilt of addiction on the part of the parent, right? Some of that is internalized stigma and internalized shame that really can perpetuate and continue the addiction cycle that often is what the parent's dealing with, right? So if they don't have the language, aren't told that it's okay to have these conversations with others, with other caregivers, with medical providers, with, DCF workers, whoever might be in their life, then that stuff gets pushed down and adding to kind of that shame. And you layer on, those shameful thoughts of, this must mean I'm not a good parent, right? This must mean that that I can't do this job well. And so, I really think the more that we can talk about it without shame and talk about how recovery is possible, how it's a process, regardless of where that parent is in their recovery process, the more supportive that's going to be for the parent, right? That it's okay to talk about it.
Awesome. Jess, you mentioned that you sort of started out in the beginning with this study of attachment. And I too am fascinated with attachment and all the different types and all the different factors that are at play there. And I'd love to hear you talk a little bit about maybe something that you learned in that early work that you did in grad school, or something that maybe even surprised you about that going into that type of research.
Yeah, absolutely, Jesse. And I think so. I first was interested in attachment when I was put in one of my work study jobs in college, actually, was working in a monkey lab, which was one of my least favorite jobs because I also had to clean the monkey cages, which was terrible. But the attachment work really started with looking at primates and the mother monkeys and baby monkeys, and how attachment formed, and the critical importance of healthy attachment for all sorts of outcomes, physical, psychological outcomes, et cetera. And so when we think about attachment, then it moved into humans, and we looked at mothers and babies and fathers and babies, and then into adult attachment and different attachment styles we have in friendships, romantic attachments, et cetera. But just to summarize the attachment research, there's secure attachment, and then there's insecure attachment. And when we are talking about insecure attachment, that's about 50% of the population, frankly, that falls in that insecure bucket. 50% of us are securely attached, 50% of us are not. And of those who struggle with insecure attachment styles, it tends to fall into a couple of other buckets, which are anxious attachment styles. So this may be when we see in parent-child relationships, children who have a lot of separation anxiety, a lot of clingy behavior, difficulty separating, worried that the parent's not going to come back. We look in romantic relationships as, is my partner going to leave me? Are they cheating on me? Are they coming home? So that's anxious attachment. Then there's avoidant attachment styles, which is where people are keeping others at more than an arm's length. You see the child has a really hard time connecting with a caregiver and withdrawing, being more distant, being more avoidant. And then in adult relationships, the same thing happens. People tend to be more aloof, or they're harder to connect. Why can't I have a relationship with him? He seems disinterested. And so there's anxious attachment, there's avoidant attachment. And then the third bucket there is disorganized, which is you never know what you're going to get. So we tend to have, starting in childhood, this primary attachment style. It doesn't mean that doom and gloom, you're stuck with that for life, because the attachment research also shows us that you can have an insecure attachment style, but if you're partnered with someone, whether it be in childhood or an adult romantic relationship, who's securely attached, that can actually raise you up. It doesn't bring the other person down. It helps the other person become more securely attached. And secure attachment's related to all sorts of things in adulthood, like health care outcomes, just general satisfaction in life, related to a lot of sort of wellness factors that have been measured. And so one of the things that happens when we talk about substance misuse and addiction and families where there's addiction is there's inconsistency and unpredictability. One of the things that helps with developing a secure attachment is the consistent predictability of that caregiver, that they are. It doesn't mean that they have to be there 100% of the time, but that it is a safe, stable, nurturing relationship that is consistent. And what happens when there's addiction in many families is you don't know what you're going to get from day to day. I feel like I'm walking on eggshells. I'm not sure if mom's going to be able to be attuned to me today or not. And so we tend to see, more anxious or more avoidant attachment styles in children when that's been part of their experience.
And that's a good segue into kind of what can we do to support these attachment relationships? I think historically in addiction treatment, it's been an approach of that parent is not healthy or safe for that child. So we're going to put them over here. We're going to remove the child. We're going to restrict access. And we're just going to assume that is better, right, for the child. And the reality of it is that that's not always true, right? If there are ways that we can support that secure attachment, even if it's not 100% of the time, like you described, right? If it's with consistent visits or with consistent access or consistent phone calls, things that are reassuring for that child, that even during active addiction or early recovery, right, those things can still support that parent-child relationship. Would you kind of agree with that, or could you talk a little bit more about that?
Yeah, I would 100% agree with that, Lisa. I mean, if kids can have access even just for 10 minutes to the best aspect of that parent, that's going to go a long way. And maybe that parent, especially in the early stages of recovery, only has 10 minutes to give, right? But we can make it happen so that that child's able to experience that. Maybe it's in the form of just a letter or a note or a text that they send at a certain time of day, depending on obviously the age of the child. But if kids can have that consistent, even in just small doses, that can go a really long way versus that vacuum of the parent just disappears and we don't know what's happening and nobody's talking about it and they don't know, it's those questions, right? Again, kids will fill in the blanks. Is mom, alive, right? If there's been an overdose before. Those are questions I hear from kids all the time. When people don't tell me anything, my brain starts playing tricks on me and I think the worst. And so having those opportunities to have, obviously when it makes sense to do so, and there of course are going to be times, I would say more exception to the rule than not, where the safety issues preclude us from being able to do it. But most of the time you're able to at least have an opportunity to have small doses of those positive interactions with parents and kids.
It was so good to hear you say that, because that was our experience doing the family work and inpatient substance abuse treatment, right? That often can be like that vacuum that you talked about where somebody just goes away to treatment, and unless their family or loved ones know what that entails, it could be like this black box of, this place they go to and then they just appear again sometime later, days, weeks, months, what have you. And what I noticed time and time again doing the family engagement specialist work is those visits, even for, I love how you mentioned the, 10 minutes of the best version of that person, right? And even if it's for a few minutes or even an hour or a couple hours, we would have visitation times where the families would come up and they would have an educational session with myself or another one of the specialists, and then they would have visitation with their families. And oftentimes we found that was that hope that not only gave the patients something to work toward and a little bit more motivation, but also for their loved ones to check in and see how they're doing and see what the plan is. So something else that I would be remiss if I didn't ask you was, a lot of times when we were talking about children, and I've had this come up in sessions as well, the topic of resiliency is brought up, and it's brought up in a multitude of different ways. I would love to hear, your thoughts about resiliency, what makes a child resilient, what kind of supports that we can offer the children of the patients that we serve and anyone listening to this to foster that resiliency in their own children.
Yeah, it's a really great question, Jesse, and I'll try to not provide a very long-winded answer to this because
please, we can go all day if you'd like.
We have it at UMass Chan, the Resilience Through Relationships Initiative, which is a program focused on how we create resilience in children through relationships. And so what we have found in just looking at the research and the trauma-informed care kinds of research, it's at the end of the day, the number one factor in recovery from traumatic experiences is the presence of one supportive caregiver in the child's life. That's all it takes. There are other factors that go into that, but I can't emphasize enough the importance of that relational aspect. We go in, we see our physician, and they're checking our blood pressure and they're, or the thing they put on your finger to check your oxygen and your weight and all those things. But people aren't necessarily asking you or asking kids tell me about the quality of your relationships, when it's relationships that should be the vital sign when we're looking at resilience and recovery from traumatic experiences, addiction, other things. So that would be where I would start when I talk about resilience. The other, and resilience gets thrown around the term a number of different ways. I also like to think about it as protective factors. So what are protective factors, ways we can think about those supports in the lives of children? So relationships. So the caregiver relationship is one of those. And the caregiver role can look pretty broad. I mean, it may be that you have a parent in recovery, so you've got a grandparent stepping in, or maybe a foster parent for a period of time, or other relationships in the child's life that are more not caregiver role, but supportive adult figures, baseball coach or a minister at the church or other people in the child's life. So thinking about what are the social supports, that's one sort of protective factor. How connected are they with their school? If they're school aged is another protective factor. They feel like the school environment's supportive. For families, children and adults, spirituality, that doesn't dictate what religion one must practice, but do they have a sense of some sort of spirituality or faith in something? Are there any special talents or interests that kids have? If they are really interested in sports or dance or art, how are we looking at supporting those interests? That can be another sort of protective factor, promote resilience in children. And there are a few others. Some of them are more innate, or like we're born with them, like temperament, for example, something that we're sort of born with. Some kids are more easygoing. My youngest is the most easygoing guy. Lisa knows this. My oldest was what they call, he has a spirited temperament. And so, your temperament can also impact how you adjust to things. So sometimes some children who have more spirited temperament's difficult. I think spirited is a more strength-based way to say it. Tend to have a harder time adjusting to transition or change, so may need more sort of reassurance in that way. We have some tools that we suggest to families, strategies, tools that you can use to promote resilience in children, things that can foster resilience and help also with that attachment relationship. One of those is things that we like to prescribe is something we call special time in, which gets back to that idea about the 10 minutes. But special time in is something, it's different than time out. We're familiar with time out, right? We're not going to talk about that today. But special time in is something I will suggest using with parents or caregivers who aren't necessarily sure what to do. I'm not sure what to say to my child, trying to address, I want to have these positive moments for connection. And so special time in is start with 10 minutes a day. And if 10 minutes seems like too much, then shorten it to 5, but 10 minutes a day, every day. It's the same time every day. So the parent picks the time. So maybe it's 4:30 in the afternoon, 7 p.m., whatever works best for your family, your schedules, all those things. But it's the same time every day. The parent picks the time, the child picks the activity. And by the way, this also can apply to adolescents too. This isn't just for younger kids. The child picks the activity, as long as it's not something where you're just zoning out on a screen, but some sort of interaction. You're shooting hoops together, you are coloring together, maybe doing a dance party, making a snack together, something like that. 10 minutes a day, same time every day. The activity can change, but the same time every day. And then encouraging, though, parents be thinking about, if you try this, you want to stick with it for at least 2 weeks, because you're going to see kids testing that end of that 10 minutes, and it doesn't mean you're doing it wrong. It actually means that they're getting the thing they need the most, which is that one-on-one attuned interaction with a parent, with a caregiver. So it actually means you're doing it right if they start to act out a little bit toward the end of that 10 minutes, but stick with it. That can help to create that consistency, right? And looking to repair attachment, promote healthy attachment, promote resilience. That consistency is really important. It sounds like a small amount of time, but actually can go a really long way. And of course, you can increase that time if you want, but we want to stick with something that's manageable. So that's one of the tools. I can keep going with some others if that would be helpful.
I'm sure we get to a whole bunch of them. But I did want to point out some parallels, right? When we're talking about, an audience that might be in recovery themselves, might be parents, that might be why they're interested in listening to this episode, or we might be supporting parents in recovery, that there are so many parallels to what supports resilience in children to what supports recovery in adults, right? So some of the things that, and Jesse, I'd love for you to add to this, the things that made sense to me: community, right? Like you need a sense of community, you need a sense of connection, spirituality, right? It doesn't have to be a particular spiritual path, but something that makes you feel like you're part of something greater than yourself, right? Having that connection to spirituality, kind of taking your whole person, so the whole child and their interests and all of the things that are part of them into account. The same thing is supportive to adults in recovery, right? Is really kind of having an interest in other areas and that consistency, right? Sometimes that's sometimes as a clinician, what I think is really helpful. Of course, it's the community, it's the connection of meetings, but it's also, I go to this meeting every Thursday at 6 p.m., right? And this is what I do every Thursday at 6 p.m. and starting to build in those routines and regulation. Like these are not, foreign concepts, right, to parents in recovery. So if they're looking at ways to build connection with their children, it's a lot of the same things that they're doing to take care of themselves in recovery. I don't know what you think about that, Jesse.
I love that. And I would also add to the community aspect that there is often opportunities for families in recovery, or should I say parents in recovery with children, to engage together. This past Labor Day weekend, there was this giant camp out music festival, family oriented event that brings a couple thousand people together. And there's kids running around. My kids have been there. There's, just all sorts of family activities as well as activities just for the children. And then you're talking about, just like going to meetings or some type of mutual aid meeting where, depending on the age of the child, there's also the children's version of that, if you will, right? So they Jess, I heard you talk about it in age appropriate language, right? So having a community for the child that they can understand in their own language and in their own terms what's going on. Why does dad have to go to meetings, right? Why does mom have to see a therapist? Why do they do these things? In my own family, I've developed this. I have young kids. One's going to be 7 on Monday. The other's going to be 5 this month, and then there's the 1-year-old. And I don't want to overwhelm them with all the ammo, if you will, of the benefit of being attached to this community of recovery. So what we found works in my house is very simply, they know dad goes to meetings to talk about God with his friends. And they have that concept, to both of your points, actually, because both of you mentioned spirituality. They have that concept of spirituality from the particular church we attend, and also from their own concepts and what they read and what they see on TV and what they talk about. So that works for them. I have brought them to one meeting so far, the oldest two. It was more of a celebration party food atmosphere meeting. And then when the actual meeting took place, we left because they wouldn't have understood it anyway. But I think it's important, at least in my own family, to not shy away from that, like I've heard you both share, to hit it head on, to talk about it, and really normalize it. That this is something that people do. We are not alone in this. There are plenty of people that are sharing in this common bond and common interest. and that, there's hope in this, and there's really a lot of opportunities to engage with other families in this too. So I forgot the original question. I just went down this rabbit hole, Lisa, but I would love to hear your remarks on that, Jess.
And I think, thanks for sharing that, Jesse. And I think this is a great example of, your family has to decide what makes the most sense and how you're going to say, explain these things to your kids in a way that's developmentally appropriate. But then, also showing that this is an important part of my life, and I make a priority to do those things and to take care of myself in that way. And I think one of the things, whether it's 12-step program or other kinds of programs, it's that social connectedness, right? Which is one of those resiliency factors. So the same applies to children too. So having, groups, knowing that there are other kids who experience addiction in their homes, or where their parents, have problems with substance misuse. And so part of that gets to that social connection too, that they're not alone. And so the same things that apply to kids also apply to grownups too, which I know Lisa was pointing out the parallel processes at play here.
And Jesse, I love that you included your kids and your family in celebrating recovery. It's very appropriate for Recovery Month, right? Which is an entire month-long celebration of recovery. But that's one of the ways that we can talk about it, right? I think it's helpful to do the education about some of the challenges and difficulties of addiction, but we can also break down that stigma by talking about recovery stories and talking about that hope and talking about celebrating recovery, right? Instead of, this is no longer an issue for me and my kids don't need to know about it, and it's just going to be over here and I'm going to shut the closet door and we're not going to talk about it. So I just think that's lovely.
Because let's face it, they're going to talk about it. They're going to find out about it. I'm amazed, at what my kids bring home, and talking to other parents that have children that are even older than ours, the conversations that are taking place, and what children pick up on. So again, my wife and I, we made a conscious effort, and after making a decision to be very open with this is a part of our life. This is, really a foundational piece of our life, and to share that with our children, to share that, I mentioned that camp out, we went there for years. And, once our youngest gets a little bit older and maybe sleeps through the night, we can stick them in a tent and go back up there. And I can't wait, because, I've watched other friends bring their kids there and really grow up in that community. And you talk about fostering resilience, and you talk about the support and the connectiveness. I love when you said, Jess, that, really resiliency, one of the main factors is that one caregiver. And I went through the mental Rolodex of all the people that I know that for one reason or another, the child isn't with their biological family, but they have that one caregiver, and just the success that they've had with just one person that cares and that's there consistently. It blows me away, the possibilities that, maybe without that support, it could have been very different. But now that they have that support, the child and the family are really not just surviving, but thriving.
Jessica, I wonder if you might want to, you said you could share lots of other tips, but for those that are, want to hear kind of what else can I do, with my child, if, either they're supporting a child whose parent has substance use, or they are a parent who has a history of substance use, what are the other things, that we can do? What, sometimes I know what comes up in these conversations is kind of how do we support repair? How do we support that, attachment and attunement, and any other kind of thoughts you have, or any other suggestions for that our listeners might want to hear?
Sure, absolutely, Lisa. So, and you can cut me off when keep going too long. One thing that I talked about special time in, but another set of tools or suggestions is something called the 3 R's that we'll use for children and families or whomever's in that caregiving role with the child. So the 3 R's are reassurance, routines, and regulation. And what reassurance is, as children, regardless of what the traumatic experience is or the concern, if it has to do with parental substance misuse, regardless of what it is, at the end of the day, kids need to know 2 things: that they're safe and that they're loved, and that the grown-ups are doing everything they can to ensure that that child is safe. When it comes to addiction or parental substance misuse, we may need to provide that reassurance a lot. The reassurance may need to look like just addressing some of the thoughts that kids may have, self-blame or wondering what's going on. So talking about things like addiction is a disease. So using that sort of disease model approach. Addiction is a disease. Mommy has a disease right now in her brain that she's struggling with. It's not your fault. So addiction's a disease. It's not your fault. You're not alone. So back to that idea that this happens in a lot of families, and it's okay to talk about it. So those 4 things: that addiction's a disease, it's not your fault, you're not alone, and it's okay to talk about it. So if you can emphasize that, and of course change your language if you're talking to a younger child versus an older one. But that's, one part of reassurance in just thinking about addiction. There's if you're wanting some materials, Sesame Street has materials for younger kids. There's the National Association of Children of Addiction. And they have on their website lots of resources for families, for kids, for teenagers. And one of the things that's on this site, and it's also in the Sesame Street materials, is the 7 C's. So the 7 C's are: I didn't cause it, I can't cure it, I can't control it, but I can care for myself. I can by communicating my feelings, making healthy choices, and by celebrating myself. So there's some nice resources on there that can provide some of that reassurance. The thing about the reassurance about feeling safe and loved, sometimes kids are going to need to hear that more than once a day. So you might hear from parent, well, Johnny knows I love him. He may need to hear that multiple times a day, and maybe in different ways. So maybe you have a note by his bed or in his school bag or something that says, Dad's got your back, or I'm thinking of you, or Grandma loves you very much. So saying it with your words, having reminders of that too. Kids may need more frequent reassurance. So reassurance. Routines is our second R. We started talking about routines a bit. Routines are something that are relatively simple to start implementing in the home. Kindergarten teachers get this like better than anybody. You walk into a kindergarten classroom, you know what's happening. Like right at 8 a.m., the bell rings, then we're morning meeting, then we do our class song, then it's talking about letters, right? Then it's snack time. You know what's happening. And the reason for that is that those kinds of routines send signals to the child's brain that they're safe. And so those routines, that consistency sends those signals to the child's brain that they're safe. So that's going to bring sort of that body's alarm system down and help, again, to promote healthy attachment and resiliency in the child. Let's see, so that was routine. So something as simple as a bedtime routine. Parents aren't doing a bedtime routine. Now's a great time to start. It doesn't have to be elaborate. It could be something as simple as you dim the lights an hour before bed, and then we do bath, read a book together, sing a song, lights out, or some sort of ritual that you have at bedtime. And homework routines for older kids, those kinds of things could be implemented. Routines throughout the week, like Taco Tuesday or Fun Night Friday, church on Sunday, go to grandma's house after, those kinds of things that happen over time. Again, more predictability, consistency can help to foster that resilience. So reassurance, routines, and then the third R is regulation. And what we're thinking about with regulation, this is helping children regulate their behavior and their emotions. And we do this in a couple of ways. One is through relaxation skills. So teaching things like belly breathing, different ways to calm the body stress response. So for some kids, it's exercise or dance, listening to music, but things like deep breathing, there are some wonderful apps that are available to help with that. Meditation isn't just for adults. It can be helpful for children too. Integrating some sort of relaxation skills. So that's one part of regulation is relaxation. The second part is really helping children to identify and express their feelings more effectively. So increasing their feelings vocabulary beyond just the little crayon box of the 4 colors, mad, sad, happy, scared. We want that big 96 crayons in the box, so multiple feelings, so they can express what it is they're talking about rather than having to resort to behavior that's not helping them in any way. So you may see, anger, it's sort of that tip of the iceberg, right? Kid who flips the desk or the table over after a parent maybe arrives late for a visit or doesn't show up at all. We see the anger, but what's beneath the surface is oftentimes feeling rejected or maybe worried that parents using again. Or feeling ashamed that the social worker's here and my parent didn't show up again and they must think something's wrong with me. So helping kids have more language to talk about what's under the surface can be really helpful with regulation. The last part of regulation has to do with co-regulation, which is having that connection with that caregiver. It goes back to that relational health piece I was talking about, knowing that even when we're not together, we're still connected. So, for example, if parents are in recovery, they're not able to, in the early stages, they're not able to have much contact with the child or the child's living somewhere else. Are they able to keep a picture of that caregiver or a t-shirt that smells like mom? Or do they have shared loveys? Like you've got your stuffed bunny, I've got my stuffed bunny, and every night I'm going to say, 3 good things about my day that happened to that bunny, and you do the same thing, and we'll say goodnight through the bunnies. So there are ways to stay connected even when they're not together. So that third part of regulation has to do with co-regulation with a caregiver, but also having some connection to people maybe they're not able to be around.
Those are so fantastic. And I've always loved that the 3 R's are so easy to remember. So even if you don't remember one, you start talking yourself through it. And you're like, I know it's an R, like it's easy to kind of get back to that, reassurance, routine, regulation. And so I love mnemonics. I love things like that are easy to remember. I would like to kind of wrap us up with kind of a little bit of our thoughts on hope. But before we do that, I wonder if we should consider, I don't know your thoughts about this, Jessie, or of course you, Jessica, about maybe having you back on, because one of the things that, we really just don't have time to talk about today, and we're really here focused on the family part of Recovery Month, is some of the systems in which families exist, right? So there's a family system, and then families exist in systems that aren't always supportive of these ways to stay connected to their children that we know are really helpful. And so, I'd love maybe if we could have you back on for a future episode to talk about what your Resilience Through Relationships grant and your work at Lifeline for Kids has done to educate, OBGYN providers, pediatricians, the child welfare system, mental health providers, schools, all of those things on how important this connection is. And I think we could do an entire episode on those systems. So I don't know if you'd be open to that conversation.
Yeah, I'd love to do that, Lisa. And I think that, that work really grew out of this idea that, I'm a psychologist, I do trauma treatment, I know treatment works, but I also know that the vast majority of children who might warrant trauma treatment or therapy aren't going to get it. They're not going to see a therapist, wait lists are too long, or there may be other barriers, access issues, but they may see a pediatrician. They're going to see a teacher in school. And so part of our work has been to really train up the workforce, people who are seeing kids day in and day out, with this concept that you don't have to be a therapist to be therapeutic. And really trying to bring that message home, whether it's in pediatrics, OB settings, schools, and other places. So yes, I would be happy to come back and talk about that, because we have not cracked the code when it comes to changing the system, but I know there are so many of us dedicated to doing that.
Well, I'm really looking forward to continuing this conversation with you, Jess. I think we just scratched the surface of all that you do, and certainly has been both personally and professionally fascinating to have this conversation, as well as, talking about, well, Lisa mentioned it, hope, right? We talked about it before we started recording, and that's sort of the golden thread that goes throughout all of these podcasts that we get to do here is really giving hope to people to share that, there's researchers, there's programs, there's professionals such as yourself that are out there really to help. And how could we connect the people that most need it, right? Those people who don't necessarily have those access, like you mentioned, to the help that is needed. So there is much more work to be done. I'm really glad to be along for the ride and part of this process.
And thank you, Jessica. So I think, we said right before we went on air that, not only is there hope because recovery is possible, but there's hope because recovery from what children have gone through, regardless of the reason for it, whether it's related to parental substance use or just any other traumas, is also possible. And so I think that's a good way for us to end our first episode of Recovery Month 2023.
Awesome.
Thank you so much.
Thank you so much for joining us today, Jessica. And I really do look forward to continuing this conversation about family systems and about all the other work that you're involved in.
Absolutely. Thank you all for having me and for doing this really great work.
Awesome. Well, this is the part where I shamelessly plug, if you enjoy this, if you're listening to this, subscribe, like, follow us. We have a great producer that puts this thing out anywhere you get podcasts. And just as a reminder, for Recovery Month, we will be back next week and weekly throughout the month of September with a brand new podcast. Thanks, everybody. Bye.
Thanks, everybody. Bye.